So we have with us today a very interesting man, a legend, someone who has brought a lot of joy in our homes. But behind the smiles, behind his interesting character, he has fought and defeated a very troublesome cancer. So today, with me here is the legend himself, Mr. KSM Kwakusintim Misa. Right. Yes, I got it right. And then the street doctor.
That's right. Clemento Sintim Misa.
Yes, this guy is a very stubborn man. He calls himself the street doctor.
Hey, really?
Yes.
Yeah.
So his job.
This is the first time I'm hearing it too.
Me, I've gone to school. I became a doctor. I said no. You have gone to the streets.
And he is a doctor.
Yes, he's a doctor for the streets.
In inform.
So he goes to the streets, gathers the myths, and then comes and shares with us. And
okay,
we try to best the myth in a way that we can.
Okay. Doctor.
Yes, sir.
Yes, patient, Maba.
Oh, they will say, oh, baby, we're doing there. You're also a qualified doctor.
The qualified doctor.
Yeah.
In what?
Oh, in a special way.
Yeah.
Because they say humor is a therapy.
Yeah.
Laughter is medicine. Nagana no cra. Yeah.
Okay.
That's right. So he's a doctor.
That's what I agree with you. Doctor of medicine.
That's right.
Doctor of laughter.
That's right. It's a Dr. KSM.
That's right.
That's right. We've been hearing about this prostate cancer, and it is said that medically, you people don't know what actually causes it. But we know.
Yes,
know. Yes, we know.
I'll get ideas here.
Yes.
I'm actually interested.
Yes, that's why I'm here. And the number one causes is if you don't do atopa plenty.
If you don't do it.
Now, okay, I know that one because you grew up from a Christian home. And that is why you are likely to get prostate cancer.
Prostate cancer, okay.
Yes. Number two, don't sort out he knows.
He knows that you're
right. Yeah, man. It's Opa, bring your findings too.
Okay.
Let's see. That's right.
He has mentioned two things. He said that one of the major causes of prostate cancer is what? Not having
lack
sex.
of yes.
Okay, and the other one is what?
It's a very, very tricky situation you put me in. Because if I say I know that it is not if I say I know for a fact, say No, but it's a very, very important thing because there are so many misconceptions about prostate cancer. Because I remember when I came back from a surgery, people were seriously asking me, why are you? You're not doing enough.
Yeah. You see?
You're not doing enough. And what could I say? Well, I do more than enough. But no, that's one of the big myths out there. But trust me, the thing is this, and for all you young men watching, once you hit the age of 40, the doctors will tell you, start checking your PSA. I think you need prostate-specific antigens. Yeah. When you do a tester, it will tell you the level of your PSA. And one thing that I let people understand is if you are a black man, it's almost it's automatic.
Yeah. The chances are very high.
Chances are very, very high. There are some things that automatically create high chances. Number one, if it runs in your family.
Family, good. It's a DNA thing.
DNA thing. Good. Say your father has it, your uncle had it, your something, brother had it. Chances are something is lacking you.
Yes.
So family is very, very important to find out whether somebody in your family has it. The next thing is age. Prostate cancer, as doctor would tell you, is the prostate glands. And they say if you're a black person over 40, chances are that your prostate glands will be enlarged.
Enlarged.
And they will pull. You can get an enlarged prostate, But here's the thing, the fact that your prostates are enlarged does not necessarily mean say what cancer.
Cancer.
I think the doctors call it
BPH.
BPH.
Benign prostate hyperplasia.
benign, yes. But you can have prostate enlarged, but you don't have the cancer. So doctors can work with you and treat you and shrink it, But the caution I'll put out here, say, the people who will be treating prostate enlargement, who will be treating prostate cancer, but they market themselves, say, oh, it's me prostate.
No, yeah.
But the enlargement does not necessarily mean cancer. So that's the point, But so the first thing is family.
Yeah.
The next thing is being black. And then the next thing is age, being over 40. Please check your PSA because, as I think the doctor said, he said prostate cancer is the second cancer killer
in men.
In men.
Yeah.
Thank you. Is the number 2 killer of all the cancers. Remember, Benyano, that's the second.
Number 1, a pampem. Say what pampem. The wicked man be out, but who are not pampem? Apa. But KSM, how about you haven't denied or confirmed the atopan. But how about keeping urine for a long time?
No. It's actually one of the symptoms. When you say we'll keep urine for a long time, if it so happens you pee a lot, and say, especially at night, almost in a very short case, maybe every hour or even less. Not just so do. I think they call it urinary retention.
Urinary retention.
And then one else when you saw is that your bladder retains the urine. And if you have a system where every RBI you have to go and pee, please, then
you have to check.
It doesn't necessarily mean you have prostate cancer, but you have to check it. A symptom.
Okay.
So it's not necessarily that there are people who are holding their urine. There are some people whose bladder is not functioning well, so it retains urine. So you can have urinary retention.
Okay.
And not necessarily prostate cancer, but it could be a symptom
if you don't check early checking can help you.
Yes.
So this is the thing. I mean, KSM is experienced. He has lived it. I have only read about it, but he has lived it. So he's speaking from experience. And I will speak from book knowledge and then tell you what the research says, tell you what medicine tells us about prostate cancer. So first of all, we can approach it as what the function of the prostate is. Prostate can be found in only men. So it is safe to say that prostate cancer affects only men. Just like maybe ovarian cancer will affect
only women.
Breast cancer can...
Both men and women.
I wanted to get you there.
Men.
It's still not
Breast cancer can affect both men and women. But prostate cancer...
Only men.
The question is, what is the function of the prostate? Why did God put the prostate there? When you see the male anatomy, how the male organ is functioning, there's the bladder, where we keep the urine. And then there's what we call the urethra, where the urine will go through. So, I don't know how to put it, but bladder, urethra. You have...
Yes.
So you can appreciate what I'm saying.
When you get to the bolo, you see the urethra straight there.
So right beneath the bladder is the prostate. The prostate nourishes the sperms, give the sperms. Yes. So it's a very good thing for men. But if you look at the position of the prostate, it is found beneath the bladder, just around the urethra. And so when the bladder is full, and then it is coming through the urethra, the prostate is there. So if for any reason the prostate gets enlarged, it will block it. That's why KSM was trying to tell us that one of the functions of an enlarged prostate is urine retention, because you struggle to bring it out. Do you understand? So that is more of what the prostate does. And the more the prostate gets bigger, the more pronounced the symptoms become. And cancer in itself is multiplication of cells. And so sometimes it's getting bigger mean that you have cancer, but it doesn't always say that you have cancer. So BPH that is the enlargement of the prostate, is significantly different from prostate cancer. Do you understand? So the prostate cancer itself is different. One way that you can know what prostate cancer is all about is, Daddy said it, you're checking your PSA. So if you check your PSA and it's high, do not think you have the cancer. It just gives you an indication that you may be having a cancer.
Yeah.
One of the ways that we will get to know whether it is really cancerous is what we call a biopsy. I'm sure Daddy knows about it. So let me just switch small. Which year did you get to know that your PSA was high? When did they do the biopsy?
I think it was about 3 years ago. Around 3 years ago. Yeah, you know. And
So was it a routine PSA check?
routine PSA check.
So you were not experiencing any symptoms?
No.
Good. So that's why I want to come. So you can be a candidate for prostate cancer
And not have
don't
any
show
symptoms.
signs and symptoms. Just like Daddy said. Daddy was just doing a general checkup. So that's why he advised that after 40 years, especially in a black man, you must check. Here on this show, we are learning some of the things that you must check. So it is important to check. So you may not experience any symptom.
Yeah.
But in your check, about 40 years, I mean, it's okay if you also want to do it about 50, but normally the earlier the better. So if you check and it's high, do not panic. Seek the help of an expert and let's do what we call a biopsy.
But what is it with sperms? Because I hear that to prevent prostate cancer, ejaculation plenty will make you
Have you heard of that?
I've heard of that. It's a myth.
It's a myth.
Okay.
I mean, there is a study somewhere done by, I mean, I've read about it that if you can ejaculate 21 times in a month.
Yeah.
So they will whap at home. But I mean, there's no scientific backing to it. There's no scientific backing. But it's a study someone did and said that, I don't know where he went to get the data from, but he said that once you masturbate or produce sperms or have sex about 21 times a month, the chance of having prostate is low. But truthfully, that's not what it really is. I mean, I like to group the causes of prostate cancer into two, what we call the modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are the ones you cannot do anything about. You cannot do anything. And number one is age. You cannot do anything about growing because as you grow, your cells multiply in addition. So the cells in the prostate can also multiply. So you can't do anything about it. But the modifiable one that seems to affect your prostate is smoking.
Okay.
You understand? And the risky behaviors, if you like. But technically, that's what it's about. So Daddy was saying that about 3 years ago, I mean, in his own routine checks, he noticed that the PSA was high.
It was actually not that high, but the doctor said it was a cause for concern because it seemed to be up. And the reason I just was so confident, said there's nothing to worry about, is because I'm physically very, very active.
Okay.
You know, like every morning I'll do my jogging, not jogging anymore, my walking. You know, at least 2 miles every morning. You know, and so when we testing at the prostate, the PSA was a little high. I'm exercising. I don't feel anything.
Okay.
I wasn't urinating blood. I wasn't all the symptoms. You know, sometimes symptoms. But when you urinate, you see pee in it. You know, and you urinate frequently. Me, I wasn't urinating frequently. I didn't see any pee, so I wasn't worried. Until one time, I went for the checkup, and the doctor said, "Charlie, KSM, it's gone high." You know, normally the PSA here is supposed to be between 0 and 4.
0 to 4.
0 to 4. I say yours is 66. Hey.
That's high.
That's
What
high.
is it for their count?
What do you think?
So he told me it was 66, you know. So he said, like you said, we have to do a biopsy. Because at 66 and they're high, and when it's high, it can be cancerous. So you need to do a biopsy.
Suarez, what do you understand by biopsy in the street? In the street,
In the street, there's no biopsy.
There's no biopsy
There's
in
no
the
biopsy
street.
on the
What is there?
No, we do a baby draw.
A baby draw?
Yes. Say the prostate nangas and any We ni connect. Bolo ni connect. Yeah, I mean, cast my mess.
And then the bolo.
Yes, I knows. So I said it's like he said, people are out there selling prostate cancer drugs. We can. I bet I'm fine.
Yes, I think by the end of this show we must address that, where a lot of people are parading us. Herbal experts and
it's so pathetic. Sometimes me show TV so.
Yes.
The same adrenaline, a headache.
Can you imagine?
A good for gonorrhea. A prostate cancer. Only in Ghana, one medicine can cure prostate cancer and gonorrhea.
Everything.
And a business.
Yeah.
Because sometimes I can imagine how many calls they're getting. Because they'll describe the situation, say, we won't say, enemy will be.
Definitely.
You know.
So the first step, that is trying to build a story for us, and that's where I want us to follow.
Yeah.
You know, the first step was he didn't have any symptoms. He went to check and noticed that PSA that is usually within 0 to 4 has now shot up to about 66. So the doctor is concerned. Obviously, it's not just the PSA. There's something called a DRE, digital rectal examination.
Digital
rectal examination. The doctor will put a finger inside the anus.
In your buttocks.
Yes, and then we'll go and feel how the prostate looks like.
Please, digital rectal
Examination.
It's like Christmas, 10 times Christmas. The akuko in your house, you want to see if he has egg.
Yes.
You do that.
I think it's street language.
It's a rectal.
Yeah, I knew it.
He's on point too.
Thank you.
Sit medicine.
So when an experienced finger gets in there, it's able to feel the prostate. And then based on the structure of the prostate, the size, how it looks.
Because unfortunately, they did it to me.
Okay.
So, not why I want to say, Doctor Bisu, you want to say you. Now,
But I've done plenty.
So he felt, say,
it's uncomfortable, but it has to be done.
Very uncomfortable. But let me assure you all, no matter the uncomfortable things that you go through, trust me, it beats you having cancer 1 million times.
1 million and more.
1 million and more.
Yeah.
Oh, so when you see somebody who has prostate cancer, no, or suffer, because you know.
Oh.
Anyway, so as you're saying, they told me that it was 66, so they should do biopsy. Fortunately or unfortunately for me, I was going to my daughter's...
Explain biopsy to him. He said they don't do
biopsy. Just say, further test.
They will take a small
portion
of prostate and go
of
and
your
look
prostate
at microscope.
Yes.
And then check how the cells look like.
Yeah. And based on that, they can determine whether it's cancerous or not. You know. So unfortunately for me, now me call a Burkina me by a graduate.
Okay.
From medical school. Until me call graduation. Until when I was there, I said, okay, then let me do the prostate the biopsy. You know. So I went to do the biopsy for about a week. The results finally came, and the doctor broke it to me and my family at the same time because friends in video call and I Zoom, whatever. You know, so the doctor called the family and I say, well, the results just said me prostate cancerous. Yeah. And so they have to do further tests to see how far it has grown.
Good.
Because the cancer, it spreads. Can go in your liver, your eye, your spine.
Yes.
The
most common part is the bones.
The bones, yes. So I had to go and do a bone scan. I had to go and do an MRI. I have to do a PET scan. All kinds of scans to make sure and spreading cold.
Teddy, it means that you are quite lucky that this thing didn't spread.
That was my whole luck. And America, for almost early detection
saves lives.
Saves lives.
Yeah.
You know, so it was detected early. They did all the checks and they realized that it hadn't spread.
Right, let me put everything into perspective for you.
Yes.
So that we build a story. I like the story.
Yes.
So this is the story.
I'm very much interested.
Yeah, very much interested. So this is the story where we have is he a young man, an old man?
At that time, he was the youngest old man.
The youngest old man. Yeah. Who in his regular checkups went to check.
Yeah.
And then they noticed that the PSA was high. But as soon as they noticed that the PSA was high, nobody said that you have cancer. They had to go and find out.
Yes.
Because PSA can go high in almost every reason. Even right after ejaculation, if you go and check your PSA, it can go high. So the fact that your PSA is high doesn't automatically mean that you have the prostate cancer. So they went to do the PSA, which we've said here that every black person after the age of 40 or 50 should be checking your PSAs to see. It should be within which range? 0 to 4.
0 to 4.
Okay, so Daddy went and then it was about 66.
0 to 66. This is word trim. Word trim.
So the doctors got a little bit alarmed. They were like, let's look at what is happening. Is it normal? Is it cancerous? So they went to do a biopsy where they took a portion of the prostate, went to examine it. And when they examined it, they broke the news to him and then the relatives that, look, we think that you may have cancer. So we have to investigate it further. And the investigation really is to know whether it has spread or not spread. And that is where the danger is. Because if it has spread, almost always we can't do anything about it. Then we have to start palliative, try to talk you through how you can go through the journey of life
and die.
Yes. But if it has not spread, the ray of hope is open. You get it. So Daddy went to do all the checks, went to check the bones, check the liver, check the kidney, check all those things.
You have to check your spine.
The spine. Now the spine are any bones are?
There was spinal cord.
Okay. I will argue. So he went to check all that, and then thankfully it had not spread. Okay. That is so we get up to this point. So when you know that it had not spread, what happened?
Well, then so I had an option. Say, luckily it hadn't spread, and if I I'm saying spread here. So they gave me two options.
Okay.
I can either do radiation or I can do surgery.
So having prostate cancer is not the end of the life.
No.
In fact, it is curable.
Yes.
You can cure it once it has not spread. And that is why we keep preaching here on health quarters everywhere we go that early detection saves life. You will not show any signs and symptoms. And the signs and symptoms like difficulty in urination, blood in urine, maybe difficulty in erections or whatever, frequent urination, those things, you may not show them at all unless you check. And if you are not careful and you don't check it and you check it very late, it may have spread. And that's the doctor's hands will be tied. So if we check it early and we find it early, there's something that can be done about it.
So what's the difference between the surgery and the radiation?
Maybe the doctor can explain more, but for the surgery, they go and they surgically remove the glands.
Okay.
They have all kinds of ways of doing it. I think mine was a robotic, whatever they call it. So they went and then removed both glands.
All these things can be done in Ghana. Don't stress it.
Oh, yeah.
If you are a Ghanaian, do not think that once you have prostate cancer. I'm sure you are aware that we do this.
I was very, very, very impressed when I went to the Prostate Cancer Center of Excellence.
Okay.
I mean, they have all these gadgets that really? It can be done.
The human resource of
In Kolebu.
Kolebu. Anyway, so they went in and removed the glands, and I came back home. I was always checking the PSA though, But after a month or two, they realized that they were seeing some movement upwards in the PSA view, Then they were not comfortable at all, So they said, well, I should come back, but this time, surgery, they said the cancers have the glands have been removed. So I should come back and do radiation.
Okay.
So I went back and I did 33 episodes of radiation.
It's not painful.
33.
Was it painful? You just entered the machine.
No. It's like X-ray radiation. Oh yeah. No pain. It's just like you're lying down.
No pain, how can you gain?
Was it?
No pain, no gain.
You can't gain.
Okay.
But I gained a lot of problem. They said the radiation caused
radiation cystitis?
The density. They said affected my bone density.
Yeah, the bone density.
Yeah. So I did the operation, the surgery. Came back, and then 2 months later, went back and did the radiation
And he said 33
episodes.
episodes.
Every one is called an episode. So, makuma 33 times.
All because we're more to pa.
But I've told you that is a myth.
Oh wow.
So
why a black man in Kwadi?
must
You are bound to have this kind of.
Oh,
you
yeah,
can.
yeah,
The chances are high.
Chances are high. So do your checkup. And you grow.
But you know,
Maybe need any people.
So there are treatment options. You understand? So it's either you go through the surgery way, and then you go through the radiation way. So the surgery, what is it? The problem is the prostate. So what we do is that we go in and then we take off your prostate so that you don't have the problem. Especially when it has not spread. If it has spread, we won't attempt it. If it has spread, we have trouble on our hand.
And manage you till you go.
Yes, and mostly it's palliative. If it has not spread, we have to. So what the doctors will do is that they will score you based on some few factors, what the biopsy is saying, what your symptoms are, your age. They use what to do, what called the Gleason score. So based on your score, you are at high risk of spreading or low risk of spreading. And then based on that, we can make a decision as to whether surgery will be beneficial or radiation will be beneficial. Surgery, we are going in, take off the prostate and try to make sure that every other thing around the prostate
is taken out.
Maybe taken out. Radiation, we are not really going in. We are putting radiation on the
To kill the
cancerous cells. So Daddy was explaining that they opted for surgery for him. But after the surgery, there was probably some small ones that was still increasing the PSA. We expect that the PSA levels will begin to drop. Let me tell you, I know of people who have had PSAs of hundreds. And then after treatment, they are still in 0 point something now. So it is not a dead sentence. So if you do the surgery, fair enough, there may be complications. Sometimes there are no complications. You are fine. So you either, based on what your score is, that you're going to do a radiation or a surgery. So the radiation, you just go into what looks like an MRI machine or an CT scan machine.
But you know that Daddy is lucky to have detected it in his late, or not late, because he's still a young man. In a very
relatively 65.
Okay.
I discovered it. Now I'm at 65. My eldest brother, unfortunately for him, he lost his life.
Wow.
Yeah, and he was 62.
This is when?
So some years.
So he had it before you got to know yours. No, your elder brother had a prostate cancer before you go to know yours.
Yes, he had it and died.
Nobody the 62 no who yeah. We discovered the 65 or the junior brother. Obviously, I say
I'm sorry.
What in
Yeah. So you knew that your brother had died from it.
Yes.
And one of the risk factors
is in the family. Yeah.
So if you know anybody, so I'm sure KSM's family now know that look, we need to keep an eye on it.
Yeah, my nephews and who are there, they are all very, very conscious about checking now, you know. And my sons as well, because once it's in the family, it's in
especially the first degree relatives. By first degree relative, I mean the mother, father line. What feeds the prostate to grow are your testosterone.
Yeah.
So the higher your testosterone, then it feeds the prostate to grow. So we give medication that suppresses your testosterone levels, and that inadvertently will also reduce your chances of your prostate cancer getting the diagnosis.
And when somebody, a patient of prostate cancer, sleeps with you, the girl, you get cervical cancer.
That is what is on the street.
That is it. It passes through. You understand?
That's also one of the street things that are not true.
Oh my God.
Most of the street things,
so it's not sexually transmitted.
No, not at all. Not at all. And what you're saying is real, because I know of a woman who said she was afraid to sleep with her husband when the husband was discovered with prostate cancer. So it's very, very true.
Yeah.
You know, but it doesn't.
It doesn't.
No, you can't. You can't.
Well, there you have it. And see, it's not a sexually transmitted disease, but it's in the DNA. It's in the DNA. If your father or mother has, or your father has it, your uncle, your grandfather, you should check.
Yes.
If your father doesn't have it, try and ask if his father had it. Because if it's in the line, it doesn't mean that it's going straight direct. Sometimes it will pass you. It will pass your son, your grandson.
Hey.
Let me ask you a question. Ask me. So Clemento Suarez is in the consulting room, and a 50-year-old man comes to Clemento Suarez and says that, Dr. Suarez,
yes,
I seem to have difficulty in urinating these days, and I tend to even urinate way faster than I am.
Okay.
And I've come to you. Okay. I've heard of this prostate cancer thing. Please help me.
Good.
What are you going to do?
Have you done your PSA? Have you checked your PSA?
No, I have not.
Oh, let's go and check it, okay?
Okay.
And before we check it, note that it's 0 to 4 that you are safe.
Okay.
If you pass 4 going, it means that your PSA is higher and your prostate may be enlarged. Okay. But don't panic. It's not automatically meaning that you have cancer. Okay. When it's enlarged, we'll try and do something else. It is what? Bios.
Okay. So two days later. So let's continue the story. So 2 days later, the patient goes to check the PSA and comes back to Dr. Clemento.
Hey, how are you? You're back.
Well.
Good.
Okay. So I just checked my PSA and my PSA is 30.
Aye. But don't panic still.
Okay.
We have to check yourself to find out whether it's actually cancerous or not. So you will do the test.
Do the biopsy.
Yes. Okay. Don't think that we can't do some in Ghana. Let's go to Kolebu. Okay. I'll refer you to a doctor in Kolebu. They have the prostate center there. Okay. Go there. Okay. I'll write for you. Go and do it.
Okay. So come 2 days later, the patient comes back and then hands you the
results.
The results. And then when you check the results,
it's positive.
Lo and behold, there's adenocarcinoma of the prostate.
Okay. I have your results.
Okay.
But please go home. I want to call your family in Zoom call.
We don't do that. Discuss first with the patient.
Well, Uncle, did they discuss it with you personally, or they just broke it to the whole family at once?
Oh, they gave me an option, say, and you want and I said, "percent me family, you know, because my wife, they were all around, you know. So no, everybody's here, you know, just.
Hey, but I think they were it almost ruined your. You know, you were in a celebratory mood. You had gone for graduation.
Oh yeah. That's what they ruined it. It ruined this. What? You know? Yeah, you have cancerous cells. You know, and they were so professional, but still, don't worry because you know we have to first of all find out whether it has spread and all of that. You know, they let you understand that there are options that you know.
But
go ahead.
I wanted to ask with the surgery, does it come with age? If you are at a certain age, maybe 50, 60, 75, you are not supposed to have the surgery. You just have to.
That one I'll leave it for the doctor.
When I was talking, you didn't listen. You made the memo. Remember I mentioned something like a Gleason score. And I said that the score is showing whether you're high risk or low risk. So sometimes they look at that and they'll give you the option. Of course, it's not. They won't say that by force, go and do surgery. They'll give you the option.
But we hear that if you are 70 and above, there's only like, you may live,
you know, on
1 year per.
On the flip side, sometimes if we get to know this thing after 70 years, we may not rush. Because prostate cancer can be a slow growing cancer. So sometimes some people may even live with their cancer for like 10 years, 15 years. So what may even kill you may not be the prostate cancer. Okay. So you see somebody above 70 years and the PSA is high, you rush, go and do, you may cause more harm than good. So there are some professional decisions we actually take. Every individual is unique. Okay. So based on your circumstances, we have to make a decision out of it. Okay. So what we are saying is not necessarily a generalization. Okay. So, yeah.
Uncle, so from the beginning of your story, you said once you are 40, as a black boy in Kwande, go and check. Why 40?
40 is when the glands will either begin enlarging or not. You know, they have made 40 just, I don't know whether it's a medical reason, but it's just a benchmark. Say, once you're 40, start keeping an eye because by nature, being black and aging, chances are you can get prostate enlargement. So why don't you check and make sure
And
that
start life. Because 40 is the beginning of life.
Uh-huh.
So start life knowing
Start
your
life
prostate.
knowing. Thank you.
Yeah.
That's right.
Yes.
Oh, that's beautiful.
And one thing too, after the surgery, the doctor just asked me, he said, am I physically very active? And so yeah, I just go for my walks and things like that. And he said this, that he can't say for sure, but he's almost certain that that is what prevented my cancer from spreading as fast. Exercise.
Physical activity.
Yes, physical activity. So please, those of you who are listening, it doesn't mean go and carry weight that you can't and all. No, nice walks, nice runs, but be physically active. Because the doctor said, for some reason, he thinks that because I was 65.
I think I agree with the doctor.
Yeah,
I mean,
and at
exercise keeps your immune system.
Yeah, I hadn't no spread everything. So it must be because you're physically active. Increase your physical activity. Go for your walks, runs. And just make sure that.
Remember, whilst we were talking, I mentioned modifiable risk.
Modifiable risk.
Things that you can do to help yourself.
Control.
And
Yes.
ones like aging, you can't control.
Yes.
Genetics,
You can't control.
You don't have a say. But obesity or you can
diet,
Diet, yeah.
Yes.
reducing or stopping smoking.
Yes,
It will
it
help.
will help.
Yeah,
It will
yeah,
reduce
yeah,
your chances. Suarez, I think that you must advise those on the streets, since they hear you more than they hear me, about these herbal medications. With the herbal medications where they think that it cures everything and it fights prostate cancer. And even not just prostate cancer, they think can fight every form of cancer, where they end up having more problems than they think. What do you have to say about that?
I mean, sometimes we just have to be rational about certain things. The person that is selling the drug doesn't even know what PSA is. So how do you know that you are treating this?
Yeah.
See, like it's fraud, high-time fraud. Because they won't just go straight and say, this is prostate cancer drug. They'll mention a lot of drugs, and you know that definitely you'll fall inside. So please, you are trying to get some money to help your family and all that, but you are killing others. System. So please, if you are 40, black man, this is what either God or Satan has given us. Once you are a black man, you hit 40. Check your prostate status. Yes.
And quickly, Patrick, very, very true. Very, very true. And the doctors will tell you that most of the cancers, prostate cancers that are presented and the doctors can't do anything about it, it is almost 90% say it was presented late.
Late.
Because
Even the 90%, we are being generous. It's almost 100%.
Most 100%.
That you are presenting late.
You're presenting late. And late presentation say, "Why my dinner did you much?" A check. If you had come earlier, but they would have been on some herbal thing. I'm not against herbal, but the truth is that
it's disheartening. They will be on herbal things.
Yes.
Some of them will go and spiritual.
Yes.
Go and be at the.
But I mean, my problem is, like Uncle KSM, he didn't see no symptoms. So you understand? So me too, I'm just walking around doing my normal things. So me, I'm advocating that once you hit 40,
check.
Yes. And how many times do you have to check this?
Once a year.
Once a year.
Yeah.
So once a year, 40 you check, 41 you check, 42 you check. Keep checking. Is it expensive?
Unless you go and check and there are some signs, then they may say, "Oh, come back in 3 months" or something.
Yeah, good.
But the checking is what prevents anything. The checking is what's going to lead to early detection. And early detection saves lives. And that's why I'm sitting here today.
Oh, nice. That has been wonderful having you and sharing your story with us and your advocacy and stuff with us. Thank you so much.
Thank you.
Thank you. Daddy has last words for us.
No, all I will say is that, as soon as I came in, I was, hey, Clemento. Clemento keeps it light and jovial. And he will ask you what is really happening from the level of the street. So I look like joke. You've been extremely helpful to many people. You have no idea.
Thank you very much.
You know, have no idea. So also to congratulate you, and I would just say, keep it up, man.
Thank you.
Because this is a
Thank you
very, very, very useful thing you're doing. I can tell you that the people who watch this will become aware of so many things. Being educated is phenomenal. So, Musumayade.
Thank you so much for
So
your
keep
kind
it up.
words.
Yes.
But before we end it, I want to know where we can test
Okay.
for your PSA, and then treatment. We've already told us that Kolebu is there. People think that Kolebu, they don't have things. But look, in Ghana, you can go to all the private hospitals there, but your last stop is Kolebu. I'm telling you, they have all the machines and all that. So
They have what they call the prostate, Center of Excellence, Prostate Cancer Center of Excellence at Kolebu. And I went to visit and I was amazed at the equipment they have there. So it's happening in Ghana.
so the
It's
test,
happening.
we can do it in any hospital.
I don't know whether I can say
No.
any hospital.
This is the truth. The truth is that PSA is not a very sophisticated test.
Oh, the PSA, yes.
Most of the labs will do it.
Yeah.
Of course, there are recognized labs where we are happy to get it, but it's anywhere, any clinic, and every medical doctor knows this. PSA is checking your PSA is important.
That one is very available. Yeah.
Thank you. So once again, from 65 Boulevard, Westland, from the studios of
Core Media.
Core Media, we here are privileged to have the legend with us. He's the legend in comedy. He's a legend in talk. So he's better than us in every way. He's better than this doctor because he's lived what we are talking about. He's better than Clemento Suarez because he's lived comedy. He is still comedy. And he's better than the two of us because he's lived talk show. He's a king of prime time. Thank you so much. Yes.
Oh, Clemento.
Yo, Jamia. So thank you. Keep it locked here. Health Quarters Ghana. We bring you the best. And please, whatever health issue you have, see a medical doctor. Thank you.